WXII 12 News. This is special coverage of the coronavirus impact.
Tonight, the coronavirus is tightening its lethal grip on America. With more than 367,000 cases and more than 10,000 people have died. But experts say the worst has yet to come. Right now, North Carolina is dealing with at least 2,870 coronavirus cases across 89 counties. Davidson and Randolph counties are reporting their first COVID-19 deaths, bringing the total to 34. 373 people have tested positive for coronavirus in our viewing area, and Guilford County has now topped 100 cases. Forsyth County is at 99 right behind them, and Davidson County is reporting 6 new cases for a total of 63. Randolph and Davie are both reporting 4 new cases, and Stokes County now has 8 cases. The strongest message yet on the need for social distancing to limit the spread of the pandemic comes from a group of scientists in North Carolina. Their research shows 750,000 people in our state could become infected with the coronavirus if the state doesn't continue its stay-at-home order. Scientists looked at the probability COVID-19 will overwhelm North Carolina hospitals under 2 different scenarios, with and without social distancing. The research shows 3 times as many people would become infected if the stay-at-home order is lifted by the end of April. Under either scenario, the forecast estimates North Carolina will not have enough beds to handle the growing threat from this virus. The researchers say the state will likely see its peak in mid to late May, but could be as late as June or even July. New tonight, the city of Winston-Salem has posted a form where people can report oversized gatherings and other violations in place to stop the spread of this virus. We've got a link to it on our website, WXII12.com. Well, top health officials are bracing Americans for what may be the deadliest weeks in this outbreak and the darkest in a generation. But there are glimmers of hope in some of the hardest hit parts of the country. Alice Barr is in Washington with this report.
The coronavirus death toll has crossed a solemn marker. More than 10,000 American lives lost. With cases expected to hit a deadly peak this week, President Trump tweeting light at the end of the tunnel, even as the nation's top doctor issues a grim warning.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment.
Health officials pleading with the public, now is the time to stay home. Don't even go to the grocery store.
Before you have to see your hospitals and your emergency rooms overwhelmed, it is on us as a member of this community, of this country, to do everything possible to save one another.
Yet at this New Jersey Costco, massively long lines with shoppers trying to keep a safe distance. New York's governor doubling fines to $1,000 for people breaking social distancing rules.
You don't have the right to risk someone else's life.
The crackdown coming as New York's daily death toll shows signs of flattening. New hospitalizations, ICU admissions, and intubations all dropping, but still high as the state's healthcare system is pushed to its limits.
If we are plateauing at a very high level.
And a new government watchdog report out today shows hospitals across the country are facing dire shortages of medical equipment, including testing kits and thermometers. President Trump pushing back, accusing the inspector general who compiled the report of being political.
You didn't tell me that, John. You didn't tell me that did serve in the previous administration. You mean the Obama administration.
The report also found FEMA has shipped out expired protective gear, while a lack of clear direction from the government is leading to fear and confusion among healthcare workers at war, with no clear end in sight. Alice Barr, NBC News, Washington.
British Prime Minister Boris Johnson is now in the intensive care unit after coronavirus symptoms got worse. He was hospitalized after COVID-19 symptoms of a cough and fever persisted. The 55-year-old leader has been quarantined in his home, or had been rather, since testing positive on March 26th. He is the first known head of government to become ill with this virus. Winston-Salem City Council met virtually for the first time since the coronavirus swept North Carolina, and members unanimously passed a resolution for the city to contribute $1 million to the COVID-19 Response Fund. That fund was established by the city, the county, the United Way of Forsyth County, and the Winston-Salem Foundation, among others. The money goes to local nonprofits aimed at helping people disproportionately impacted by the coronavirus. Council members also unanimously passed a resolution authorizing payment deferral on all city-issued outstanding loans. The Forsyth County COVID-19 Response Fund that we just mentioned awarded its first grants today. 15 local nonprofits will split more than $1 million. Crisis Control Ministry, the Bethesda Center for the Homeless, Hope of Winston-Salem, and Samaritan Ministries are just a few of the nonprofits receiving that money. With the CDC now recommending but not requiring face masks in public, a lot of people have questions. A doctor in Winston-Salem just did a comprehensive study on this and talked with our Kenny Beck today. The CDC recommends people wear a cloth mask. So what works best? Dr. Scott Segal tested more than 400 masks and made them more than a dozen different ways. He says there's an easy way to test your fabric. Just look up.
The rule of thumb we're suggesting is hold it up to a bright light or to the sun. If you can easily see the light passing through and you see it outlining the fibers, it's probably not the best material.
Higher grades of cotton with greater thread counts are better, but staying at home is still your best protection. North Carolina Health and Human Services Secretary Dr. Mandy Cohen is stressing that for people who use cloth coverings, they need to use them properly, along with good hand washing and disinfecting surfaces.
If used incorrectly, face coverings can expose someone to more germs rather than less. The very best evidence on reducing the spread of the virus is to social distance and stay home.
To our north, Virginia also seeing a surge in COVID-19 cases and deaths. Health officials there say they're dealing with nearly 2,900 cases. 497 people have had to be hospitalized and 54 people have died. Well, Boeing says it's going to suspend production of its 787 planes in South Carolina. 6,800 people worked there. Boeing says benefits will continue through the suspension period for all of those employees. With stoppage at the North Charleston facility and at Boeing's Seattle area plants, the final assembly of Boeing's commercial planes is on hold indefinitely. Today's announcement comes on the heels of a stay-at-home or work order from South Carolina's governor, with only essential employees and services exempt. Well, changes are coming to North Carolina's prison system. Officials say prisons will not accept offenders from county jails anymore, and they're going to dramatically reduce prisoner transfers for the next 2 weeks, starting tomorrow. Commissioner of Prisons Todd Ishii says over the past week, 7 inmates have tested positive for coronavirus at 3 different prisons. Those are Johnston, Caledonia, and Noose Correctional Institutions. Over the weekend, face masks were distributed to all staff and offenders at those prisons. Now an update to a story that had a lot of you reaching out to us offering to help. The Winston-Salem doctor whose truck was stolen from his driveway now has it back. Dr. Chris Grimes tells us it happened about 24 hours after we aired the original story last week. The theft left his family with just 1 vehicle. He risked exposing his wife and 3 kids to COVID-19. Winston-Salem police say they found the truck tucked away at an apartment complex.
I was really surprised. Not just at the speed at which the news story calls somebody to call in, but just from the sheer fact that it was found in one piece. We feel a little bit better than we did before, just knowing that there's everybody there is willing to help somebody in need.
No word yet from police on whether they've arrested anyone for the theft. Well, there are a lot of engaged couples whose weddings have had to be postponed because of coronavirus. But as our Brendan Bates shows us, things for wedding planners rather, are doubling as therapists with their couples. Brandon's joining us from his home tonight with how a planner is reassuring her brides. Brandon.
Yeah, well, Brianna, good evening to you. From the caterer to the music, you probably know there is so much that goes into planning a wedding. And with the coronavirus still lingering around, this is causing a huge headache for everybody in the industry.
I have had a few brides call me crying.
As a wedding planner, it's Ashley Murray's job to bring to life the perfect fairy tale wedding for couples.
It's had an impact on all of us as wedding professionals.
But with the coronavirus causing people to cancel large gatherings, Murray has had to break the news to 5 of her couples that their wedding would have to be postponed.
Trying to keep my couples calm as well during this whole crisis. It's been a little bit crazy. No one really knows what's going on. So trying to play therapist has been a big role for the past week.
She says unless you've planned a wedding, you probably don't realize the amount of moving parts that go into one.
Wedding planning in and of itself, there's a roller coaster. And so now with the coronavirus on top of that, and not knowing where people need to be and when bans are going to be released, it's kind of put more stress, well, I should say a lot more stress on my couples.
Venues all over the country that usually look like this are now closed up with no certain open date in the future.
In this industry, in this profession, you've just got to be really flexible.
Murray says she's been in constant contact with her couples, reassuring them everything will work out and not to give up hope.
In the end, they're still going to get married and it's going to be okay.
And I talked to another woman who is in the wedding industry. She said it's not just impacting weddings that are supposed to happen now or the next week or the next couple of months, but prospective clients aren't able to come look at the venue and do the tour. So this is going to be felt, she says, for months to come. Reporting live from my home tonight, Brandon Bates, WXII 12 News.
Brandon, thank you. People and businesses all across the region are stepping up to help people battling the coronavirus on the front lines. A librarian at the Eden Public Library used a 3D printer to make face shields for colleagues at the Rockingham County Health Department. Look at that. It's also helping the folks over at Social Services. Greensboro-based ATI Decorative Laminates is also making face shields for local doctors and nurses. ATI plans to make more than 3,000 face shields in all. Those look pretty good. Production set to start immediately. Wrangler and Lee Jeans parent company Contour Brands is producing 60,000 patient and isolation gowns for North Carolina hospitals in response to medical supply shortages. They're also making a donation to Second Harvest Food Bank of Northwest North Carolina to keep families in need fed.